day 4. The mission's rushing along. We've only got one more day after today, so the big team's going to go in. We're going to meet all the management, which is going to be great. They're really engaging well. There's then going to be a double valve replacement that Baffle Jan's going to do. And I'm off to the National Cardiothoracic Centre in Koilabu to see if we can engage with them with a pacemaker programme for Pace for Life. So lots more to see. Hope you enjoy it, and thanks for tuning in. Teaching Hospital. We're here to meet the team and see if we can get pacemakers going. Pleasure to be here. I'm a cardiothoracic surgeon from the United Kingdom, but pacing, I've really come to understand it is something just so important. This small little device can save the lives of so many people, and really the problem, it seems to me, here in Africa is you all have the technical ability to put them in beautifully, but people can't afford them. These devices are just so expensive here that you can save the lives of these people who you're otherwise sending home with heart rates of 20 and 15. It must be absolutely awful sending these people home when actually you want to treat them. So this is what this charity is about. This charity is about getting pacemakers to you in Africa so that you can treat everybody. My dream is that you'll never have to send somebody home who cannot afford a pacemaker, which would be absolutely wonderful. What I would like to do is for you guys to join this randomized trial. What is this? Well, the FDA said to the University of Michigan, you must do a study to prove that these are great devices when you recondition them. And they managed to access some funding for this, because when the American FDA says do a trial, it comes with a vast amount of funding. And so they've set up a randomized trial that is fully funded. Here's what happens. If you can get local ethical approval for this from your hospital, then we set up the study, and you say to a patient who cannot afford any pacemakers, you say, okay, you can't afford your pacemaker, so would you like to join this study? They'll be randomized to one of our reconditioned devices, 50% of the patients, or a brand new Medtronic device bought from the local reps here in Ghana, together with the leads and the wires. We pay directly your local Medtronic reps. We'll also pay for leads and wires for the reconditioned device. So you will have no cost whatsoever for any of the devices or any of the leads and wires. Hello, I'm absolutely delighted to be here with Professor Lawrence Schrebauer. He's the director of the National Cardiothoracic Centre, an amazing surgeon trained by Hugo van Ermen in Aalst, and it's an honour to be here at the National Cardiothoracic Centre. For yourself, we're here to talk about pacemakers, but you have such an established programme here. Tell us about your service and what you offer to the people of Ghana.
Well, our pacemaker program has been on for about 32 years now.
Wow, yeah.
Yes, and it was established by Professor Frimpong Boateng. He was the person who set up this center in 1989 or so. And I don't know whether you've had a chance to meet him also.
No.
Well, he's now retired. But he set up this center and started the program for pacing at this center.
Yeah.
It's been up and downs, but generally we'll be going up and progressing. And unfortunately, as you know, the problem is with our patients being able to afford the cost of our services, because we don't have a very viable insurance system that helps the patients to afford the care of the cost of the services that we're able to render.
So how many people do you think you send home with complete heart block? Do you think it's a lot?
It's difficult to say exactly. It is how many people that have significant bradycardia who need pacing who are not even referred. Because in the periphery there's quite a number of them. If you get here, one way or the other, we try as much as possible to make sure that you can give you a pacemaker.
Yeah.
For example, as you said, we sometimes reuse pacemakers for the people who cannot afford it at all. But there are some people who have been waiting for pacemakers and they haven't been able to bring up the finances. Quite a number. Today is a clinic day. I'm sure there will be at least one or two that will be referred who cannot readily pay but have to maybe plan. Sometimes it even takes about 4 to 6 months before they're able to gather enough funds to be able to pay for the service that we can render.
Yeah, and so we're going to try and bring a randomized trial here where we're going to provide either reconditioned or brand new pacemakers.
As we said, I think that is a win-win situation for our patients, and I think those are primary considerations. And the pacemakers being refurbished, and they are quite good quality. There was one that you said the longevity was about 60 years. And I said, wow.
Yeah.
Do they last that long now? But these are the new generation of pacemakers.
Great. Well, it's a pleasure to meet you, and thank you. You're already the biggest heart surgery unit, and we want to make you the biggest pacing centre in the region, which will happen very quickly. Really nice to meet you. Hi, I'm with a really enthusiastic group of trainees, and I have Penelope. You're now a trained surgeon here. Tell us a bit about the training here in Ghana.
Okay, the training is quite intensive. It's a 4-year period, over a 4-year period, after which you write an exam and a dissertation to become a fully qualified cardiothoracic surgeon. And we do all the specialties here: adult, pediatrics, vascular, and after which you can go out and further subspecialize. So that's a bit about our training here.
And what operations have you done this last week?
This last week, I've done a PDA, a fistula. We haven't operated much this week, but previously pacemakers, joined in on open heart, that's ASDs, VSDs. So that's a few tetralogies.
Great. So a great centre here, a great place to learn.
A wonderful place, and we really enjoyed your talk, and we hope you'll be coming here more often.
Great, yeah. Thank you very much, and best of luck with your career. Here we are in the National Cardiothoracic Centre cath lab, a good Siemens device. Really nice setup, beautiful place that hopefully very shortly we'll be doing a whole load of reconditioned pacemakers. Very exciting. Hi, I'm with Raju. She's the Medtronic representative for pacing in Ghana, but actually she's only one of 4 that are experts in pacing. Yeah. So say hi, Raju, and tell us about pacing in Africa.
So in Africa, we find that yes, we have the patients all right, but most of them are not able to afford. And another issue too being that we don't have skilled trained personnel being able to implant. So we find that you are doing a lot of single chambers and few dual chambers. So we think that it's a great initiative to help people who just go away, who need pacemakers but go away and die because they can't afford. So Pace for Life, we are in for it.
Wonderful. Yes. And we all want to help Raju as much as possible. She's going to be on our Pace for Life technical support group because we want to help her because it must feel a bit lonely, mustn't it? You've got 1,000 people on your books.
It is.
We're going to help her out. But it's going to be absolutely wonderful to work together, and thanks for taking us around Accra to meet all these great people.
You're welcome. Okay, bye.
Come for an extra trip to the Ghana Military Hospital to meet another team to talk about pacing. I'm here with Colonel Adumako. You're a cardiothoracic surgeon.
The only one in the armed forces.
And here behind you, what do we have behind you?
So this is the proposed or the ongoing cardiothoracic unit that is being built for the Ghana armed forces. Yeah, which will help to serve the whole nation, the whole West African sub-region, and relieve the burden of the teaching hospital. It's going to be a 3-layer, that's the ground, first floor, and there's a second floor. And to have everything, cath lab, 3 theaters, vascular, cardiac, and thoracic theaters. male ward, female ward, executive ward, everything encompassing it.
Great.
Yeah,
And we're here to talk about pacing because I think you're very excited to hopefully, there's a great need, isn't there?
Yes, there's a great need because we have a lot of patients who usually, while waiting for funding, die, unfortunately, because some with rate as low as 20, 30, they get syncopal attacks and die. So
yeah, and you said even the military are broke.
We are broke. Everybody's broke. Everything in the whole world. So this is a very welcome situation, and we'll be very interested in enrolling with the program and the research because we have quite a number of patients which we can enroll.
Yeah, and maybe we'll bring you to England.
I hope so too.
Colonel Odemaker wants to come to England and learn some pacing as well.
Especially the dual chamber, the CRTs.
And great. Well, hopefully we're going to set you up with a really successful program here. Absolute pleasure to be here. Great. Thank you. Yeah, great.
Yes.
I'm with Dr. Adu Samu.
Asumanu is my name. Yes. General surgeon.
Yeah, and he is in charge of the ethics board here at the 37th Military Hospital, and we've had a really enthusiastic response. They're going to review the ethical board approval for the My Heart, Your Heart randomised trial in the next few weeks, and hopefully we'll have a very productive collaboration together.
Hopefully, yes. You and then pass on the comments as appropriate.
Great, that's military speed for you. Straight to the main man today. How amazing is this? We're in the Institutional Review Board office and we have these wonderful people sorting out our study super quick. They're going to fix everything and mend it. Thank you very much. And,
You're welcome.
and that's great. And paperwork being done right now.
We were here in March, I think, I remember that visit well because I remember walking to UGMC and seeing this amazing infrastructure and building that you have, and walking into your care and ICU areas and theatre, and being really excited about the potential that this place had. And at that time, our plan was to get your program up and running. So we along with Dr. Jan, did the first cardiac surgery cases that you've ever done here at UGMC. And you may remember that at that time I was quite explicit that our mission and aims is not to come here and do mission and do operations. Our aim is to walk beside you as you set up on your own a sustainable cardiac surgery service for the people of Ghana. So this mission, this visit is a continuation of that aim. We were delighted that you were able to keep doing some cases in our absence last time. This visit is to try and just augment that, really, to provide the expertise and the equipment and keep the relationship going to facilitate your journey as you become a sustainable cardiac surgery unit. I think that's very much all I have to say, really. That's why we're here. And so far we've had a great week. We've actually only got today and tomorrow to go. We leave tomorrow night. So it's been good, and lots and lots of challenges, but lots and lots of progress as well. So thank you all.
That's world record speed, that is.
Rob, take another picture. Smile.
Poor guy. Being bashed into it. Yeah. Well done.
Doing well. Let's go.
So Mr. Frimpong yesterday, in the morning, he had a really leaky aortic valve. And so the blood, rather than getting round his body, was sort of shuffling backwards and forwards in his heart. So yesterday we took him to the operating theatre and we got him off to sleep, etc. And we found the valve was leaking and we put a new one in which isn't leaking. So now the blood's going forwards out of his heart, getting round his body. We've had to give him some extra blood and things because we were a bit fooled by him preoperatively. We thought his blood counts were fine. But because he'd had so many water tablets, his blood was really concentrated. It was thick going around his body. So when we gave him some fluid, which we needed to for his operation, it brought his hemoglobin down, which made him very, very anemic. So we've had to, and he's bled a bit after his operation, so we had to give him some blood transfusions after. And we're really pleased because that seems to be working, that his feet are starting to warm up now. So he's getting more blood around his body, and his tissues around his body should be enjoying having heart sending lovely blood to his tissues, and hopefully in time his breathlessness will get a bit better. he's going to feel tired for a few weeks, but we're hoping that in a few weeks' time he'll realise, crikey, what have I been putting up for the past couple of years, and get back to maybe chasing his kids around the garden or lifting heavier bales of recycled clothing which he trades in and sells at the market. Okay.
How are you feeling, sir?
I'm okay.
You're good. Are you feeling well?
Felt a little pain on my chest.
Yeah.
A little.
Yeah.
Yeah.
That's good. But you're looking really good. One day after surgery.
Yeah.
You were having the operation yesterday at this time.
Yes.
You've done really well. Well done. So we're here with Richard and his research team at UGMC. They are super brilliant, really great bunch, and they're going to get the Pace for Life randomized trial going here at UGMC.
We are really excited about it and we look forward to the prospects. So we'll keep you posted and updated.
Great. Good job, guys. Great stuff. Hello, I'm here with Susan, one of the very most senior nurses here, and with Susan we've just set her and her staff up on this. This is our 40 hours of e-learning. We've got a huge amount of resources on here, from the basics, anatomy, physiology, pathology, huge numbers of things, balloon pumps and all sorts. She was quite shocked when I was on it, but how does it look like? Do you think that will be fun?
It will be fun. I like the fact that you see somebody talking to them, not you reading. It's like very interactive, unlike where you sit and have to read, but there's somebody talking directly to you, and it's I like that one.
Great.
Well, I think it's going to help us have more interactions than rather you reading through. So it's great.
Yeah, well, there's 40 hours of videos on that. It's a lot of hard work, but you can have it, and we've sent it out to 40 of your nurses, so I hope you'll really enjoy it, and if you're successful at the end, you'll get a certificate certified by Teesside University. And
Thank you.
Great, brilliant. Thanks for joining in.
Thank you too. Thank you. Thank you.
Great, so this is Zachary Musa. She has rheumatic valve disease and has a narrowed or stenosed aortic valve, which is also leaking, and then a stenosed mitral valve. So the plan today is to do a mitral valve replacement and an aortic valve replacement, and Dr. Jan is doing the surgery today.
What valves are you using?
Available, we have mechanical and tissue valves, but because of his age, we are going to use the mechanical valve.
400 giving. Thank you.
I want you 200
down the right.
Down the right.
Okay, so giving 200 now.
Okay, let's go.
It's going. I can't get hard to stop properly in Ghana. I don't know what's going on.
Kim says it's your fault, by the way.
Well, how? I mean, what can I do other than put potassium directly into the coronary artery at large volumes?
It's Ghana proof.
They made it stand stuff.
Yeah,
caution.
23 is going?
23 is there, but it's a bit tight.
Off the right side.
Not quite. Can't get it in. What happened to the lovely 15-minute clips?
Boring everybody.
They're just becoming like massive. I wake up and I think, oh, I watched all that thing. Oh, God, so much.
Yeah. I'll get the stats on it if anyone's actually watched the video.
Oh, can you get that? Knife, please.
How did that case go?
Okay, I can say it's okay because it's a very severe stenosis of the mitral valve, and the whole area, the leaflet, is calcified and fibrosed, so the valve was not sitting properly. So it took some time to get it properly fixed. But now we are out and everything looks okay. The aortic valve was not of a problem, but it's also rheumatic and it has some calcification. So we have to take some calcium from the annulus, and then so it's a tough case. But we are done, and the patient is doing fine, and we are okay with that.
And where's he not gone? He's gone to lie down, hasn't he?
Yeah, he needs to rest. He needs to rest.
Great job, well done.
There's no such thing as emergency protocol.
So that's the end of day 4. You can just see our patient just recovering here, being transferred to the ITU bed to get safely to the intensive care. We've had a really busy day, had a great time engaging with management here at UGMC, and it was so fantastic to hear such a positive response of 3 units on our whistle stop tour. Really positive about providing pacemakers for people in complete heart block when previously they'd been sending them home. So thank you everybody for your enthusiasm with Pace for Life and Edwards Heart Week Matters. It really makes a difference to these units, all the generosity and support that you're showing. So tune in tomorrow for our very last day, where we'll perform some heart surgery and get on the plane home. I'm here with surgical residents in the National Cardiothoracic Centre in Accra, and these fantastic people are really keen to learn as much as possible. Maybe coming to England. Would you like to come to England and get us out of bed? So a great keen group, all learning cardiothoracic surgery, hoping that we can come and work together in the future.